people are coming into us nowadays and they're asking for something more natural. People are really afraid of fillers. They're afraid of looking puffy. They're afraid of looking like a bowling ball, and then the celebrities are getting all their fillers dissolved. So I think be really aware of that sensitivity. People are aesthetics is really going into a regenerative leg now, which is a good thing because we're looking at the inside of people and what's happening on the inside and how that affects the outside because it's one body. So I like that we are looking at aging, at our biological clocks, and that we're looking at peptides and we're looking at all these things that will help us work even better and slow down that aging clock.
Yeah.
So people know that, they're hearing that, and they're asking for something more natural. So when we offer them this biostimulant, you got to tell them this is not a filler, although Radiesse can be used as a filler. But when you're using it as hyperdilute, it is not a filler. It is something that we're just, like I say, again and again, fertilizing. Right?
Yep.
We're just fertilizing. So we're just adding little tiny layers each time.
Yeah.
You can put it in full strength if you want. If you want volume in certain areas, or you can put HA fillers in, whatever you prefer.
Yep. And you're gonna separate out. I tend to tell my patients more like 6 weeks. I like it to set in, especially since this is hyperdilute radiesse. If you're using that, I think it really depends on how hollow they really are. Sometimes I will bring them in 4 weeks, but with it being hyperdilute radiesse, it is going to be a fill component as well as a collagen stimulation component. So I like it to settle for about 6 weeks because I think at that point in time, some of the methylcellulose gel has started to degrade out, and then you'll really see what really is a fill versus what is going to start getting stimulated as collagen. And as always, with any of these biostimulators, it is a series of treatments. I tell my patients it's going to be 2 to 3 with regards to this. And so I think that's where you need to keep in mind these biostimulants, as we're talking about. Yeah. They're fertilizers. They're causing the body to respond in a way. You're not going to see immediate results for the most part, except for this being a little bit of a fill. But ultimately, it is going to take a couple of treatments. So these are kind of your biostimulants on the marketplace. You have your PLLAs. You have your calcium hydroxyapatites. There are other ones out there called PCL, polycapronolactone. If you go into Europe, it's called Elance. They have a skin boosting one called Gori out of Korea as well. And then PRP is considered one. But to me, be a little careful with PRP because you have to know what quality of the PRP you're getting and are you doing the right amount of PRP. I don't think people concentrate the PRP enough for the most part. You need to get 5 to 8 times concentration to really, really get the results that you're supposed to be looking for. Okay.
And longevity, we talked about this before. So biostimulants are going to be building your own collagen and elastin, and you're going to keep that for years. So your patient will keep it for years. The studies went out 12 to 18 months. So that's where they say, like Sculptra is 24 months or 23 months. And Hyperdiluted Radiesse or Radiesse is 12 to 18 months. But that's where the studies ended. So we have to know what we're doing. And if we talk about what's happening, it's not the filler we're putting in, it's the result of it that people are going to keep. And that's what our patients love so much about that it's so regenerative.
All right, injection techniques. So some of these are microinjections or mesotherapy cannula injections. I know Sue asked cannula size. I use a 22, 2 3/4 or 70 millimeter. I want it as long as possible. I think 22 is a very nice one. Yeah. You're not going to bump into any big blood vessels and get into it. You can still do that with the 25. So I like the 22s when I'm using hyperdilute radiesse.
Me too. Here's the hands.
So you can see the little blood on that one, the dorsal injection site. This was just half a syringe. This is my 85-year-old patient. So I decided to keep it a little calmer because she had really thin skin. She loved the results. So in 4 weeks, we came back and added another half a syringe.
You're
on each
good.
hand.
You didn't even pop a vein.
Of course
You're
not.
good.
I'm supposed to be, right? And then we have arms, the inner arms, the outer arms. You can work on the whole thing that tightens up and really works on the crepiness into the area. Décolletés are great. You know, all of the areas that are related to skin. I mean, I wish I could inject the whole body. That would be great to
We
be
need a
able to do
shower
that.
and biostimulant shower is what we need.
So how do biostimulants compare to hyperdilute radiesse? You know, I think they're all the same in a sense. You know, I think the only thing in my mind when I'm thinking of it and why I tend to like it more for like butts and when people are super hollow is you get that extra fill power that you can't get off of something like a PLLA. I need some volume to instantaneously be there. That's the reason why I do shift a little bit. And as they get full-ish, then I switch back to PLLA to continue that thickening skin power because I don't need to facially volumize them as much anymore.
Yeah, they both work very, very well.